If you went through chemotherapy and you came out the other side with a cancer-free scan, but your hands and feet never came back to normal, that's not in your head, and it's not something you necessarily have to accept as simply the price you paid. There's a specific reason it happened, and there are often specific reasons that it's still there. Chemotherapy-induced peripheral neuropathy, or CIPN, isn't one thing. It's what happens when certain chemotherapy drugs, in the process of killing cancer cells, also damage the structures inside the peripheral nerves that produce energy and transport nutrients. 3 drug classes are most commonly associated with this: platinum-based agents, taxanes, and vinca alkaloids. They work differently, but they often affect the same fundamental systems inside the cell. Now, here's the part that many patients are never told. Your longest nerves are usually the first to be affected. That's why symptoms usually start in the feet before the hands. Now, that's not random. It's what we call length dependent. The nerve running all the way to your toes has the greatest distance to maintain, so it's usually the first to struggle when the nerve's internal support systems are disrupted. There's another pattern that surprises many patients, and that's that neuropathy can continue to get worse for weeks and sometimes months after chemotherapy has already ended. In the medical literature, this is sometimes called coasting. The damage that occurred during treatment can continue to play out in the nerve tissue even after the medication is no longer being administered. For many patients, this is the most confusing part. They think, I finished treatment, so why am I still getting worse? Now, I want to clarify something because chemotherapy-induced neuropathy and diabetic neuropathy are often clumped together, and they're not really the same thing. Diabetic neuropathy is usually a slow metabolic process that develops over years. Chemotherapy-induced neuropathy is often a direct toxic injury that develops over weeks or months and is frequently related to cumulative dose exposure. But here's where they become similar. Once a nerve fiber is damaged, regardless of what caused that damage, the nerve still needs the same fundamental things if it's going to have an opportunity to recover. It needs adequate blood supply, it needs metabolic stability, and it needs a signaling environment that isn't working against it. At 360 Physical Medicine, we refer to this as the nerve environment. The nerve environment is the collection of factors surrounding a nerve, including blood flow, metabolic health, inflammation, and the conditions that influence its ability to function and recover. Chemotherapy created the initial injury. What influences recovery afterward is often what is happening within that surrounding environment. Now, there's a pattern that we see in chemotherapy-induced neuropathy that stops feeling like a coincidence. Numbness and tingling that begin in both feet. Symptoms that slowly move upward, and balance that becomes less reliable. Not necessarily dramatic, but a growing sense that you don't trust the ground the way that you used to. Many patients later develop symptoms in their hands. They often describe it as feeling like they're wearing gloves that aren't really there. And then others experience hypersensitivity. The bed sheets hurt. Socks become really irritating to keep on. Things that shouldn't be painful suddenly are. And then for some people, the primary symptom isn't numbness at all. It's burning pain that seems completely disproportionate to anything visible from the outside. What's also notable is how often patients tell us that their oncology team did exactly what they're supposed to do. They treated the cancer successfully. They got the scans that they wanted, and ultimately saved their life. And then the conversation shifted to, the neuropathy may improve on its own, or it may not. Now, of course, that's not a criticism of oncology. Their job was to treat the cancer, and hopefully they did that successfully. But it doesn't mean that the nerve recovery portion has to be left as an open-ended question. Patients are left trying to figure out what comes next. And there's another layer to this, because chemotherapy-induced neuropathy often develops gradually And because it usually appears during the same years many people start noticing age-related changes, patients assume they're simply just getting older. But when the timeline is reviewed carefully, the symptoms frequently begin during the treatment or after the treatment. And they follow a very recognizable neuropathy pattern, not a normal aging pattern. And here's something else that's important to understand. Peripheral nerves do not heal on the same timeline as skin or muscle. Nerve recovery is slow. Sometimes it's measured in months, sometimes even longer than that. And it's heavily influenced by the nerve environment. That's why the whole wait and see is not always as neutral as it sounds. Every month spent in poor metabolic environment, every month spent with inadequate circulation, every month spent without addressing factors that influence nerve health, those months matter. Now, to be clear, some nerve damage can be long-lasting or even permanent. But we also see patients whose recovery potential was never fully explored because the focus remained on symptom management rather than addressing the factors that influence whether the nerve can even recover. Now, that's a very different conversation. One story says there's nothing that can be done. The other says we haven't fully explored the factors that influence nerve recovery. Those are not the same thing. And let's be honest about what this actually costs people. This isn't just numbness on a chart. It's not trusting your legs on stairs. It's reaching for a countertop because you feel unsteady. It's avoiding uneven ground. It's looking down at your feet every time you walk. And perhaps most importantly, it's the frustration of being cancer-free, of winning the fight that mattered most, and still not feeling like yourself in your own body. Patients don't come to us asking for a number on a report to change. They come in wanting to walk through a grocery store without thinking about every step. They want to pick up their grandchild without worrying about grip strength. They want to move through life without constantly monitoring their feet. They want to feel more like the version of themselves that existed before the treatment started. So why does this often remain unchanged? Usually it's not because the nerve is incapable of any recovery, it's because the approach stopped at symptom management. A medication that reduces tingling may reduce symptoms, but it doesn't automatically improve circulation to the nerve. It doesn't automatically improve metabolic stability, and it doesn't automatically address the environment influencing that nerve's ability to function. That's the gap. It's not a lack of effort. It's not a lack of determination. These patients already proved they can fight. The gap is often in what was actually being addressed. Now, here's something encouraging. Patients who experience meaningful improvement often describe it in the same way. It's usually not a dramatic overnight change. It's subtle. It's walking from the car to the front door and realizing they didn't think about their feet. It's standing in the shower without bracing against the wall. It's reaching for a coffee cup and realizing the grip is simply there. It's small moments, but meaningful ones. There's also a clinical pattern worth knowing. Function often improves before sensation does. Patients usually notice improvements in balance, confidence, and daily activities before they notice major changes in numbness or tingling. That's often one of the earliest signs that the nerve environment has shifted in a more favorable direction. This way of thinking is the foundation of the 360 neuropathy system. We don't start with masking symptoms. We focus on the factors that influence nerve health. Our system is built around 4 pillars: metabolic health support, circulation and tissue health, nerve function and recovery capacity, and finally, balance, gait, and sensory integration. Because regardless of what caused the damage, whether it was chemotherapy, diabetes, or something else entirely, a damaged nerve depends on all of those systems working together. We don't treat chemotherapy-induced neuropathy as a completely separate category requiring a completely separate approach. We focus on the nerve environment because that's what influences whether a damaged nerve has the opportunity to function better and potentially recover. If you've gone through chemotherapy and you're still living with numbness, tingling, burning, balance problems, or that feeling that you can't fully trust your hands and feet anymore, that may not be the end of your story. It may simply mean that the factors influencing the nerve recovery have never been fully explored. If you'd like to understand whether your specific pattern fits what we typically see in patients dealing with neuropathy, that's exactly what we discuss every single day at 360 Physical Medicine.